from the National Public Health Emergency Team, which says 3 more people with COVID-19 have died and the number of confirmed cases has increased by 302, bringing the latest total in the Republic of Ireland to 2,121. In Northern Ireland, there have been 34 new cases, the total there 275, and 3 deaths since the last set of figures. This evening, the President signed into law the emergency measures in the Public Interest COVID-19 Bill 2020. That's the bill giving extra protection to people in rented accommodation and providing billions of euro in income supports for employees and businesses. Let's talk now to our correspondents. We're joined from government buildings by our political correspondent, Holohan. We'll go to him in just a moment. And here in studio by our science correspondent, George Lee. George, we've had a series of announcements by the Taoiseach and Tony Holohan over the last number of weeks, beginning with that dramatic statement by the Taoiseach on the steps of Blair House in Washington when he was visiting the White House, announcing the school closures and some other measures. And at each stage, we've had further restrictions announced and implemented. Are we expecting something similar now in the next few minutes?
I certainly think that appears to be what's on the cards. And it's very interesting as you go back to the Blair House statement by the Taoiseach, because it was clear then he was ahead of the posse. He was very quick out as soon as he got any information from the National Public Health Emergency Team, so much so that he gave his press conference in Washington, and he moved well ahead of the UK and elsewhere in relation to the steps that he took. So he has wasted no time. The National Public Health and Emergency Team has been meeting for at least 2 days now to decide what to do next. They've been looking at the rise in the numbers, and they've been trying to assess the impact on the health service in particular. And I think they're very concerned, because they explained this last night, about 2 particular things which jumped to my mind. The first was the pressure on intensive care units in hospitals, and secondly was the clustering of cases in relation to COVID-19. And so they're looking to see what else that they can do. One of the things which is really noteworthy, if you look at these numbers on the intensive care, is that at the moment I think we have 56 cases in intensive care, actually maybe 59. And this time last week we had 12. It's gone up nearly 5-fold in the space of just 1 week. Now, if the numbers in intensive care continue to grow by 5-fold, you'll have busted the system in terms of intensive care capabilities within 2 more weeks probably. So they're really, really worried about that, because that goes to the heart of whether or not the health system can cope. And they emphasised last night that this was a huge issue for them, and it will be interesting to see now whether or not the issues which they're
just to be clear about the process here, sorry George, just to be clear about the process here, all along Mr Varadkar and Simon Harris and others who've spoken about this from the point of view of the government has said there's 2 principles, if you like, guiding this. First of all, we listen to and take and follow the medical advice, and we take, I think what Simon Harris at one stage said was what they hope are the right decisions at the right time. And at the right time, they have said exactly that. They're being led by the scientific and medical advice to do the best thing, because it is about the health system and people that they're putting first. They've basically stopped the economy in many, many ways, because it's so important to get this right. And so the word from the medical leaders and the scientific leaders is number 1 on this, and they are so concerned, not necessarily about the numbers, the headline numbers themselves, but about the serious illnesses and the number of people who are ending up in those in the serious capacity, in serious area. And we know the numbers last night in terms of the deaths. They were a big jump last night, and another jump again tonight. All right, I'll come back to you in a moment on this, George. Let me go to Holohan, as I say, standing by government buildings. We're waiting for that news conference and those statements to get underway, Micheál. But in the meantime, perhaps you might just bring us up to date on the legislation that was passed today, the last act, I think, of the current Shanad legislation to bring in some more protection for renters and these income supports.
Yeah, I mean, this was the second piece of legislation in as many weeks, wasn't it? Huge emergency pieces of legislation that contained laws and regulations. This providing income support for the hundreds of thousands of workers who are going to lose their jobs as a result of the COVID-19 crisis. Also, some certainty for tenants that ban on evictions for 3 months and a rent freeze as well. All the types of things that, of course, in ordinary circumstances, government wouldn't do, and they have said consistently they couldn't do, but they can do it now. And it follows on from those fairly sweeping powers that were given to the Gardaí the week before that allowed them to intervene, and the government indeed can order people to stay in their homes if they believe there are affected areas around the country. So A lot of powers are there at this point, and there isn't probably an awful lot left in the locker that can be done. But some of the concerns that have been raised in the Dáil and in the Seanad over the last 2 days have focused in particular around workplaces and what is deemed essential or non-essential work. Could you see moves in that direction tonight? A further tightening of restrictions there. Also, when it comes to social gatherings, it has been reduced considerably down to just 4 people at this point. Could that go even further? Could it be down and just confined to immediate family? Those are the type of measures that could be looked at and have been looked at over the last few hours.
Just, Micheál, in terms of further legislative response, new laws, what we've seen this evening has been signed by the President, we're told this evening. That's it in terms of what this government can do until a new government is formed because of the whole situation in relation to a new Seanad.
That is the view of the Attorney-General, that is the view of the country's top civil servants, and it's the view of the Ceann Comhairle as well. The Trinity College Professor of Law and Labour Senator Ivana Bacik, speaking in the Seanad today, took a different view, and she says there is legal opinion that says when the new Seanad, and that count should be completed next week, when it resumes in a few weeks. Well, there is a way around this. However, the clear view from within government and the one that they're following, the weight of legal opinion, is that is it. The curtain has come down on the 25th Seanad, and as a result, the Oireachtas can't pass any more emergency measures. And for that reason, they say a new government is needed. The Dáil must elect a new Taoiseach, because it is that Taoiseach that would appoint 11 senators, and all the necessary parts of the Oireachtas would be in place again for further emergency legislation if it was necessary. And there's a view that it may well be. The Taoiseach saying today that what's at stake here are citizens' lives. He said it's very different to Brexit and all the emergency planning there. What that was about was about protecting citizens' identities and their livelihoods. This is about protecting people's lives. And all the while, too, the message coming from ministers and the Taoiseach in the Dáil and Seanad over the last few days is that things are going to get worse before they get better. Simon Coveney saying today that people have to brace themselves for the fact that things will get considerably worse.
Micheál, thank you very much indeed for that. George, it's about people's lives. That's what we're talking about this evening. That will be the issue that will be addressed by Mr Varadkar and the Minister for Health and Tony Holohan in just a few minutes. And in terms of that, you were talking about the pressure that's expected to come on, and already it seems is beginning to show on the intensive care facilities here. What are the contingency plans in place that may be able to deal with that and confront that?
Well, what they have managed to do, they started off, at least they said they had 255 intensive care beds, intensive care rooms, and that they were adding an extra 25, I think first, then another of special rooms. Another 29 were approved as well, and they're looking to use the intensive care facilities in the private hospitals. So there has been an increase in capacity there. But if the rate of increase in admission to intensive care were to continue, it would not take very long to exhaust all of that. And you're talking about very sick people, not necessarily very old people, but very sick people when the virus takes a hold and goes beyond their lungs and so on, where they need that particular care. And that's what they're worried about. They're worried about medics being in a situation where they have to make decisions about who they would and wouldn't treat, which would be an awful situation for them to be in, and to be in that at such an early stage, because our numbers in terms of confirmed COVID positive tests are quite low. They thought they would be 10,000 people by tonight. We only have just over 2,000. So we've done quite well on the numbers. There may be issues about testing there, but if they ended up with difficulties in terms of treating people at a relatively low number of positive tests, that would be really difficult for medics and others to live with in the future. So it's up to the system to help them, to make sure that we continue to slow the pace at which these cases are coming towards them, and that means to continue to do what we've been doing, which is restricting our movements.
A word, George, about the composition of the cases, because it is quite striking that a high proportion of those who are contracting the virus are the people who are in the front line, the medical workers. I think is it upwards of a quarter, certainly over a fifth. 23%
now on the figures which we got tonight, which would have been for the end of Wednesday. And so that is an issue, because they are really important to get back to work, but also very important to care for, because they have contracted in the most cases the disease through working for the state, through serving the people, and there's a great concern in relation to them. One of the issues that comes up all the time for them is the whole issue of personal protective equipment. We know that from last night we were getting to very short stages in terms of goggles and so on, but there's a huge order has gone into China, and we will be getting the first delivery of that here on Sunday, where an airplane is going from Ireland to China, turning around. The people in that airplane aren't even able to get off that airplane. It'll take 25 hours to get there and back with the first load of personal protective equipment to help those people and protect those people in the health service. And that will be distributed as quickly as possible as soon as that equipment is there. And there are 10 flights in that first batch, and in all there'll be 300 flights in total in the delivery of the massive order which is there. So the HSE is doing everything they can, but what they're finding is that the cases are coming, in terms of the serious ones, very quickly, and the level of hospitalisation is quite high so far, and that's what they're worried about.
Perhaps that's something that the Taoiseach will address when he speaks very shortly. Now we can just show you the scene at the briefing room in government buildings inside the complex, where the media, as you can see there, are standing by. The signer is standing by, just waiting the arrival of the Taoiseach, who will be accompanied, we understand, by the Minister for Health, Simon Harris, and by the Chief Medical Officer, Dr. Tony Holohan. And just to explain the process here, the National Public Health Emergency Team are the people who are meeting today. They've been looking at the various issues in relation to the Covid-19 pandemic, how it's been responded to here by our health system and by our public authorities, and then it makes its recommendation to the government. Now we will have the Taoiseach coming to the podium and about to address the media.
Good evening, everyone. Tonight I want to speak to you about the next stage of our national response to the coronavirus emergency. And I want to start by expressing my condolences to the families and friends of the 3 people who passed away today, one of whom we understand was a healthcare worker. Before I do so, I want to also thank all of you at home for continuing to abide by public health advice. By doing so, you are saving lives and protecting our health service and its wonderful staff. Once again, thank you to everyone who is working as part of this great national effort, whether at work or working from home. Our country is rising to this challenge, and I'm convinced we will prevail. At the beginning of this emergency, I told you there would be difficult days ahead. We knew that the virus would spread in our country, that tragically many of our citizens would suffer, and that some would not survive. I said that we do all that we could to protect the health of our citizens, to prepare our health service and support our healthcare staff, and try to cushion the blow to our economy, our businesses and your livelihoods. Today, with cross-party support, the Oireachtas has passed further emergency legislation. This will help business to keep their staff in work. It will increase social welfare payments to those who've lost their job as a consequence of the emergency, including the self-employed. And payments under these new schemes have already commenced. In addition to that, rents are frozen and there'll be no evictions. When I spoke to you on St. Patrick's Day, I said that more actions would be required in the coming weeks to slow the spread of the virus. Over this month, we've seen the numbers of people falling ill increase every day, and we've seen loved ones and colleagues die. Guided by the expert advice of our Public Health Emergency Team, led by the Chief Medical Officer, we believe that now is the time for these further actions. I said there would be a calm before the storm, and the aim of every single action that we've taken is to reduce the impact of that storm in our country, to slow the virus down, to push it back, and to contain it. Throughout all of this, the Government has acted on the advice of the Chief Medical Officer and the National Public Health Emergency Team, an expert team of public health doctors, virologists and scientists. Today they informed the Government that the number of confirmed cases has now exceeded 2,100, that sadly the number of deaths is now 22, and there is a day-on-day increase in the number of admissions to intensive care units. In fact, the number has doubled since Monday. Transmission in the community now accounts for more than half of all cases. And there continues to be an increasing number of clusters, many of which are in nursing homes and residential care settings. Earlier today, the Government received further recommendations on the actions that we need to take to protect our people. These are in addition to all of the existing measures that are already in place. So with effect from midnight tonight, for a 2-week period until Easter Sunday, April 12th, everybody must stay at home in all circumstances, except for the following situations: to travel to and from work for the purposes of work only where the work is an essential health, social care or other essential service that cannot be done from home. A list of these will be provided. To shop for food or household goods or collect a meal. To attend medical appointments and collect medicines and other health products. For vital family reasons, such as providing care to children, elderly or vulnerable people. To take brief individual physical exercise within 2 kilometres of your own home, which may include children from your own household, as long as you adhere to 2-metre physical distancing. For farming purposes, that is, food production and the care of animals. All public and private gatherings of any number of people outside a single household or living unit are prohibited. The virus might be in your household already, so please don't spread it to somebody else's. Sadly, this prohibition includes social family visits that are not for the vital reasons which I already mentioned. A further range of non-essential shops and services will be closed. The guidance given earlier in this week in respect of essential retail outlets will be revised to reflect this. Adult community education centres and local community centres will be shut. All non-essential surgery, health procedures and other non-essential health services will be postponed. All visits to hospitals, residential healthcare settings, other residential settings and prisons are to cease, with specific exceptions on compassionate grounds. Shielding or cocooning will be introduced for all of those over 70 years of age and specified categories of people who are extremely vulnerable to Covid-19. Detailed guidance will be available. Travel to our offshore islands will be limited to residents of those islands. Pharmacists will be permitted to dispense medicines outside of the current period of validity of the existing prescription, in line with the pharmacist's clinical judgment. All public transport and passenger travel will be restricted only to essential workers and people providing essential services. Apart from the activities that I've listed, there should be no travel outside of 2 kilometres radius of your home for any reason. These are radical actions aimed at saving as many people's lives as possible in the days and weeks ahead. We're not prisoners of fate. We can influence what's going to happen to us next. There is no fate but what we make for ourselves. As we enter this most intensive phase of restrictive action, the government's emergency response will be ramped up. Local emergency response will be led by local authorities who will bring together all the state agencies, as well as local community groups, charities and volunteers, to ensure that all of our citizens get the help that they need at this exceptional time. Freedom was hard won in our country, and it jars with us to restrict and limit individual liberties, even temporarily. But freedom is not an abstract concept. We give it meaning every single day, in the way we live our lives and the decisions we take willingly to protect our loved ones and colleagues. So I'm asking people to give meaning to our freedom and liberty by agreeing to these restrictions, restricting how we live our lives so that others may live. I'm asking us for a time to forgo our personal liberties and freedoms for a greater cause. And I'm appealing to every man, woman and child in our country to make these sacrifices, not out of self-interest, but for the love of each other. To begin each day knowing that every single imposition, every single inconvenience, every irritation, every lost opportunity will save lives and help our health service to cope. The whole world is suffering during this pandemic, and Ireland is no different. What happens next is up to each and every one of us. So show your support for our healthcare staff. Show your support for everyone who is working in essential services or looking after vulnerable citizens. Show that you care for your families and friends. Stay at home. Tá dawan omláin ag folingt, agus níl éireann difriúil. Is gach aine inis cad a tarlóig. Tá spáin de cuid tacaíocht dibreathirí sáintiúla. Tá spáin de cuid tacaíocht don seirbhísí riachtanach agus daoine atá ar lá cuidiú. Tá spáin go feici tú ina dhia de clán agus de chóide. Fan bhaile. Gur maigad.
Thank you, Taoiseach. Last night you all stood and applauded our frontline workers, the people who are putting themselves in harm's way day in, day out to keep us safe. Tonight we're asking you to stand with them again. They are staying in work, so we need you to stay at home. We have become so aware of what's happening in the rest of the world during this global pandemic, but our personal worlds must now shrink again. And I know you must be asking yourself, what's next? But in the face of a crisis where we know the actions we can take as individuals can make all the difference, we have to constantly ask ourselves, can we do more? And we can, and we will. We must stay home in all but the most limited circumstances that the Taoiseach has outlined. You must not gather in public or private outside your own household. Older people and those we identify as particularly medically vulnerable must stay home altogether. And we will have to help them do this. We will help them as a government and we will help them as a community. I know this is already so strange and so difficult, and it's not going to get any easier in the days ahead. But we have to take the further measures advised by our public health experts to give ourselves the very best chance of reducing the impact of this virus and saving lives. It has been a shock to many of us to see the number of deaths grow in recent days. This is the reality that we face. This is the now that we are living in. So we have to accept these temporary but difficult restrictions now in the hope of better times ahead. The time will come again where our life goes back to normal, when the distance we now have to put between us can fall away. And when that time comes, we believe we will be able to say to each other, we did all that we could to save lives and protect our country to the very best of our abilities. So many people have been kind enough to send words of encouragement and solidarity to those working so hard in my department. And one I read today had a quote from Victor Hugo on the front. It said, "Even the darkest night will end and the sun will rise. If we endure now, we can hope to see that sunrise sooner. If we make these intense and difficult changes now, we may not have to live with them for as long as we otherwise would. But we need to stay the course, and put simply, we need to stay at home."
So we have, in the National Public Health Emergency Team, since late in January, put preparations in place and begun to track this virus as it moved around the world, as it appeared in this country. And at a number of stages throughout the course of this, we have come to government asking for measures, and measures that have been implemented that societies had to bear and societies had to work with us to implement. We think we see signs that are encouraging us that this is helping, but we think we need to go further. The signs that are telling us that this is helping, first of all, we've seen over the course of recent weeks a drop in the number of contacts associated with each case that we identify and that we follow up in contact tracing. This gives us encouragement that the public is working with us. We've also seen that the day-on-day increase in the total number of cases has slowed down relative to what we might have expected a number of weeks ago. But this does not tell us that the worst is over. It tells us that we're having some early impact. But we're concerned, as I shared with you yesterday evening, that some other measures in relation to the disease, particularly in the context of admissions to intensive care, as the Taoiseach identified, those have continued to increase day on day. And while we think we're still at an early point in the course of this disease, we think now is the time for us to move to strengthen the measures further, to try to spend 2 weeks to really suppress the transmission of this virus as much as is possible in the community. We still see something in the order of 50% of cases identified with no links that can be identified for those individual cases that tell us how that individual picked up that infection. And this tells us that the virus is in the community. And we think in the early course of this infection, with the support that we've had from the public, that with these additional strengthening measures, we can drive the infection back out of the community and more into households, and that we can continue our public health advice to people who have symptoms to self-isolate for 14 days, to make contact with their GP, and that their household contacts isolate with them. We think this measure, when we look at the number of contacts per case, will significantly interrupt the transmission of this virus, which is our objective, and turn the infection, which is a community-based infection, into one that's a household-based infection. And we think that that can have an impact not only in the transmission of the virus, but importantly in the progression that we have seen in the serious infections that have resulted in intensive care admission, and ultimately feeding through into protecting and saving lives as much as we possibly can. And so we've advised again that in respect of this range of measures, that rapid, early, comprehensive, coherent advice of this kind, in line with the advice that we have from the European Centre for Disease Control, is necessary and will help to drive this infection from the community in the way in which I've set out. Thank you.
Taoiseach and Dr. Holohan, it's only 3 days since the last meeting of the MPHET where an escalation of the previous restrictions was recommended. This has obviously come quite quickly. A couple of days ago you hadn't even intended for MPHET to meet again. Can you underline the gravity of the situation, how it's escalating, as to why you felt it was necessary even to convene that extra meeting? And is there any indication at this point that you can say for certain that in 2 weeks you will be able to lift these new restrictions?
So Taoiseach set out some of the measures that we identified that caused us to respond. As I've said, we've stayed very closely watching this disease over its course day on day, and the measures that we've tracked obviously include the total number of cases. We've also identified, and I shared some of these with you yesterday evening, because as we met with you yesterday evening, we did indicate that we were going to meet again this morning, because we were getting concerned about the rise in the number of infection admissions to the intensive care units around the country, that we were concerned about the, albeit still a small number, the rise in the number of deaths that we had seen, that we had seen a continuing increase in the number of cases overall, which had doubled over the course of the week, as had the number of intensive care unit admissions. And we had seen, which gives us concern, a number of nursing homes, 10 in the country in total, and a number of other residential facilities, as well as healthcare institutions reporting clusters of infection. And given the vulnerable nature of the populations in some of those settings, and we think all of those measures in combination show that although we've seen some slowdown in the growth of cases overall, some of the other measures have continued to increase. And we think that now, over the course of this week, having seen that data, and you'll be familiar with what we shared with you in the early part of the week, some of those important indicators have more than doubled in the course of 3 or 4 days. And we thought it was not appropriate for us to wait until next week and the next scheduled meeting of the National Public Health Emergency Team to evaluate whether further action was necessary. And for that reason we met this morning, so that we continue our pattern of early and decisive response to the measures and the changes that we see happening in relation to the disease. In relation to 2 weeks' time, it's not possible at this point to predict exactly what will happen over the course of the disease, but our hope will be that by instituting these additional strengthening measures in terms of seeking to significantly reduce as much as possible the transmission of this virus in the community, that we will have the impact that we're seeking to have. And we'll be reporting and evaluating that on a daily basis over the course of those 2 weeks.
Aisling Kenny from RTE. Taoiseach and Minister for Health Simon Harris, can I ask you, is this essentially a full lockdown now? And also, in terms of cocooning, what does this mean for elderly people? What about volunteers and carers who have to visit elderly people? Can that still happen? And finally, just how can the 2 kilometre radius be policed?
Okay, I've always been reluctant to use the term lockdown because it means different things to different people and can mean different things in different jurisdictions. So that's why I don't like to use that term. I prefer to be specific about what we're imposing on people and asking people to do rather than not. But this is very restrictive, really saying to people that They shouldn't leave their homes, that if you go out for exercise, you should do so individually or with your children and not go within 2 kilometres of your house, and then only leave for the essential purposes, which I mentioned earlier. There isn't much more beyond this, I think, that we could do in terms of further restrictive measures. In relation to the 2 kilometre radius, that is going to be very hard to police. We have enacted powers that allow the Gardaí to detain people, and we can impose penalties on people who are breaching these rules. But the best way that we can achieve this is by consent, by cooperation, by people understanding why these rules are being put in place, to protect themselves, their friends and families from Covid-19, to protect our healthcare staff, to protect our health service from becoming overwhelmed. And I think if people understand that message and buy into it, that's going to be much more powerful than anything that our 15,000 Gardaí can do. But they will be available to police it as needed. Sorry, the final part of your question? Yeah. I might ask CMO to comment on that a bit more, but in terms of where it is allowed to leave your home, that does include carers going in to see elderly people, professional home carers, for example, family carers and so on. So it does include them. They can still carry out the essential care that they've always been carrying out and need to carry out for reasons people will understand. But the concept of cocooning really is that people over 70 who are at high risk and those under 70 with a list of chronic diseases should stay at home and put in place arrangements for someone to check on them, to visit them, to make sure that they have food and medicines, to make sure that they're okay. There's a panic alarm system in place. An Post have kindly agreed to make their postmen and postwomen available to help out with this, and there'll be other actions as well. But I might let Tony maybe fill in a bit more on that.
I think we know this is a significant further ask of people in vulnerable groups, but I think we have good reason to believe, anecdotally and with some of the market research information that we have, that already people in some of these age groups are effectively already doing this, in as much as possible staying in their homes, limiting their contact with other people and minimising it to those people who are involved, as the Taoiseach has said, in providing basic care and support to them in the home. What we'll be advising people is to stay in the home and to follow the detailed guidance which is being made available this evening. It will be made available, published on the HSE and HPSE website, full of detailed practical arrangements for families and for individuals themselves who are cocooning themselves over the course of the 2 weeks. We understand that it is a significant ask of people. That's why the period of time is short in terms of its application. We'll seek to do everything we can to try to support people in the home during the course of that particular time.
So there we're leaving the news conference and briefing at government buildings. The Taoiseach there announcing a series of measures. He described them as the most intense phase of the battle against the Covid-19 infection. Everybody, he says, must stay at home, except, and he identified a number of exceptions, those who would be essential workers travelling to and from work, and a list will be provided of who is in those categories of essential workers. People will be allowed to leave their home to shop for food, to attend for medical appointments or to collect medications. They will be allowed to leave their home for vital family visits, to care for a child or perhaps or an elderly relative, and will be allowed, each of us, to have a brief exercise, was the phrase used by Mr Varadkar, within 2 kilometres of our homes, and all public and family gatherings outside the family unit, those living in the same house, are prohibited under these measures. And as you heard there, there'll also be provisions for what's described as cocooning, people who are over 70, who may be considered to be at particular risk, or those who are, by reason of some medical condition, particularly vulnerable to the infection. Let's just get some reaction to this from Mary Favier, who's a GP in Cork and is president of the Irish College of General Practitioners. Dr. Favier, thank you very much indeed for talking to us. Now, you were listening to that news conference. What do you make of what you've heard?
I think it's always hard as a member of the community to hear these types of restrictions, to hear that there's now going to be a mandatory requirement for people to stay at home. However, as a doctor, as a general practitioner, I welcome them. We, as general practitioners, would welcome them because they're based on the science, they're based on the evidence, and they're coming from public health, who we fully support in terms of the measures they've taken to date. And I think we can see that the measures we have taken have worked. So, for instance, in my practice, those elderly, those who are vulnerable, have been effectively self-isolating, and they're not sick. And that is fantastic news. However, the difficulty is those who have been going about their business and perhaps not restricting as much as they might are those who are becoming unwell, and they're bringing the virus into their homes. And I think the point is very well made. If we can limit this to a virus that's now within households, we can actually fight it. And I think it's for us as a community to fight it. Doctors can only do so much, but they are behind the scenes. The front line is truly the community. And it's the social solidarity, how we all now live together, that will make the difference.
We'll be bringing the 9 o'clock news a little bit later than normal in just a few minutes. But Mary, just a comment on what Tony Holohan was saying there about the figures for people presenting with a serious illness and needing perhaps intensive care. And that, it seems, is what has prompted particularly the further meeting of the emergency team today and this recommendation and decision this evening.
Yes, and indeed, that's the experience of general practitioners. We tend to be effectively the canaries in the mine. We hear these things first. And even just today in Cork, I heard about a number of cases being presenting to hospitals and inquiring ventilation and intensive care. And 2 of my own patients are in hospital. And my thoughts are with those. And so we know that it's pushing our hospital service to its capacity. We need to absolutely protect the services we have, but we need to protect our frontline staff who are in those services, not just the doctors, not just the nurses, but the porters, the security men, the cleaners. Everybody who works in those services needs the community to do their bit, because only by them staying healthy can they then help your loved ones who are going to present to those hospitals, and we need to keep that to the absolute minimum we can.
Mary Favier, thank you very much indeed for talking to us. George Lee is still with us here in studio. George, the impression listening to what the Taoiseach had to say there is that this really is, as he said, the most intense phase of this battle against the infection. But this is really the full panoply of restrictions, is it not, now coming in for the next 2 weeks at least?
It is. He said that there isn't much more that we could do apart from these kind of measures which they've got. It's very fast for us to get to use the entire arsenal so quickly. If anybody was ever in any doubt about whether or not we are at war, this is it. We are at war against this tiny virus, and the only weapons we have are our own actions. When you look at what Tony Holohan said there, he said we are trying to drive this virus out of the community back into households, to restrict it, to make that the front, because it's easier then to deal with it in terms of the spread. When you look at the figures that we have and the analysis of where the cases which have turned up positive have been, you'll find that 56% of them now are in Dublin. And the difficulty which we have is that because the country is so small, that could easily spill over into other areas of the country where the burden isn't so great. So these restrictions will certainly take care of putting some further tightness in around that to kind of contain it. It will help the rest of the country in particular. And for those in Dublin or in areas where there are clusters, these measures will help the stop of the spread. But the most important thing that these measures do is that they give us the hope that if we were to engage in these, that at least our health services might be able to help those people who are going to become so sick and very sick, some of them, not all of them, but very sick, if we do what we're being asked to do here. And the other point I would just comes to my mind is that I know that they've said that this is for 2 weeks until the 12th of April, but this virus will not be gone in 2 weeks from any country. And so one wonders that is this going to be for longer? We've been told from the beginning that we have to get used to a new way of living, and maybe we might be getting used to it, as Simon Harris said there, we have to shrink our personal worlds a little bit more. But at the end of the day, it will be worth it, but it's very, very difficult for people to do.
Right, George, thank you for that. A final word with Micheál Holohan, who's outside government buildings. Micheál, the Taoiseach was asked there about ensuring that these restrictions, particularly people moving no more than 2 kilometres from their home, actually is abided by. Can that be enforced? And really, he said it was very hard to police. The government and everybody involved here is depending on people's consent and cooperation.
Yeah, and I think that is why perhaps they took until now to make this big decisive decision. The last decision has saying that they can't do much more beyond this, and they have felt at all times that the majority of people were perhaps slightly ahead of these big decisions, and they will hope that that is the case again and that people will buy into this. The words of the Taoiseach there, where he said people will have to restrict their lives to save the lives of others, and that is what is going to happen from now on. But it is a matter of the public embracing this particularly difficult measure.
Micheál, thank you very much indeed to that. Thanks to George and also to Mary Favier for joining us a little earlier from Cork. That concludes this special news programme. Just to say the 9 o'clock news will, of course, have reports and further analysis on what we've just been listening to and talking about in just a couple of minutes. But for now, from all of us here, a very good evening to you.